Now, PCOS, we've given an overview of the condition, what causes it, but it impacts your health, but also your daily life. So would you say that PCOS causes fatigue or feeling tired?
It's possible. It's not one of the symptoms that we think of very commonly, but if someone, say, has like sleep apnea, they're sleeping poorly, it's possible.
And I think that some of those changes in the hormones can impact sleep and then causes fatigue and how people are able to perform daily. And also inflammation. We hear a lot about inflammation and how our health impacts inflammation, which is very true. What would you say about PCOS and inflammation?
It's possible. It's one of the things we don't know that much about, but I will say kind of like, empirically or word of mouth, I've had some patients say that with maybe changing their diet to have less inflammatory foods like red meats, like sugars, that they do feel better.
Yeah.
So it is possible.
And inflammation is definitely attributed to a lot of how we feed our body, what we fuel our body with. So I think that, again, is that overhaul of nutrition and how it impacts inflammation. Now, you touched on this before, but mood swings. How does PCOS impact mood swings?
Yeah, it actually is associated with increased risk of depression and anxiety. And the way I explain that, we don't actually know chicken or the egg. Does it cause depression and anxiety? Or because it is literally touching on every aspect of your health, does it increase the likelihood that you will feel depressed or anxious because you're dealing with so many health issues? But for people with PCOS who feel that, it's not in your head. It truly is associated.
Yeah, I see that a lot with a lot of reproductive health issues can lead to, like you said, chicken before the egg, a lot of mood swings, and then also impacting our mental health. How do you talk to your patients, or how do you kind of make them understand the connection between mental health and PCOS?
Yeah, it's so important. One is just to bring it up, because I think a lot of people don't think to bring up their mood or their mental health, but it is so important because it touches on all of these things, your ability to take care of yourself, to exercise, to, watch what you're eating. All of these are tied to your mental well-being.
Absolutely. And I think that once we're able to understand mental health and its importance in overall physical health, the two are very related. And so patients actually do feel better when I bring it up because they don't feel as if they are scared to bring up mental health issues. So it's a very inviting question. Now we're going to touch on PCOS and pregnancy, where I know you and I have spent many of our visits and encounters with patients because PCOS impacts pregnancy. So can you get pregnant with PCOS?
Yes, you can. And so it may make it more difficult if you are skipping periods, if you are not ovulating regularly. But there are a lot of people with PCOS who have perfect periods. They're ovulating every single month. So this is where we come into the every woman is different. So it is something that can be a very common cause of fertility problems, because if you're not releasing an egg, you can't get pregnant that month.
I wanted to emphasize that first part of the answer that you said, yes, you can. Because many times what people may read or see, they come into the office with the notion, if I have PCOS, or if that's the diagnosis, or if I've been diagnosed with it before, now I can't get pregnant. And so most of the time that I spend with patients is reassuring them that that does not mean that they can't get pregnant. And so I see a lot of tears. I see a lot of relief, sighs of relief when I explain that to patients, because that really is the fear that they came in with, is that because I may have PCOS, then I can't get pregnant. Now, if someone does have PCOS and does get pregnant, can it impact their baby's health?
So it does increase your risk of things like insulin resistance and diabetes, which in pregnancy can mean an increased risk of gestational diabetes, where you have higher blood sugar in pregnancy. And that can definitely impact, the health of the growth of the baby. People can have a slightly increased risk of things like birth defects if it occurs early in pregnancy. And then later, closer time of delivery, it can increase the risk of things like C-sections.
Yeah. And that's a lot of what we saw when we were delivering babies at the time, is if someone has that diagnosis of gestational diabetes, that we really have to watch those patients and the growth of the baby, and also for the delivery to make sure that there was a safe delivery. So it definitely does impact both mom's health and baby's health. Now, what are some myths about PCOS that you want to bust? You can do it right here on the HERS podcast and bust all those myths.
So important. So actually, that fertility one is probably the biggest, because patients are either, sometimes they're told or they kind of hear this message that you are infertile. infertile. Like you cannot get pregnant. That's usually not true. And also this becomes important. People may have heard of the term Ozempic babies or where, you may have had difficulty with ovulation and trouble getting pregnant. Sometimes with those weight loss, with things like GLP-1s, they actually start to ovulate regularly without realizing it. They may get pregnant without intending to. So it is very important that people don't get that message like you cannot get pregnant, both in terms of, not discouraging people, but also not giving them a false sense of, oh, well, I don't have to worry about birth control because I've been told I'm infertile, because oftentimes that's not the case.
One other myth that I've heard, and I wanted you to comment on it, is if you have PCOS, that you are obese. Can you bust that myth?
Yes. So we used to call it lean PCOS, where someone didn't have the obesity, the overweight, but still had the hormone imbalances. So, a fair number of people with PCOS do not have a problem with weight, but they have everything else. They have the issues with ovulation and the insulin resistance.
And that is another thing, is that sometimes even I, from a bias of a medical professional, because of how we were taught about PCOS, the greater percentage of people who have PCOS might be overweight and or obese, but there are people who are not any of those who have PCOS. So a lot of times there would be patients, early in my career who might come in and you're looking for that perfect list, that diagnosis, and they may not fit that category. And so obviously, as you practice more, you see more patients, you start to see that that doesn't necessarily correlate.
A lot of people, that delays their diagnosis too. I found a lot of patients, who are slim and they've gone to doctor after doctor being like, what's going on with me? And you're like, well, you clearly have PCOS.
Right.
But, other doctors may not have even thought of it because they're sort of envisioning someone has to be a certain, weight, a certain body type.
Stay tuned for more discussions with leaders in women's health. Remember to subscribe to our channel and follow us wherever you get your podcast. And with that, I want you to stay well, and I'll see you soon.